What is Stilizan? Stilizan is in a group of medications called conventional antipsychotics. It works by decreasing abnormal excitement in the brain. What is Stilizan used for? Stilizan is used to treat the symptoms of schizophrenia, a mental illness that causes disturbed or unusual thinking, loss of interest in life, and strong or inappropriate emotions. Stilizan is also used on a short-term basis to treat anxiety in people who have not been helped by other medications. How to use Stilizan? Stilizan comes as a tablet to take by mouth. It is usually taken 1 or 2 times a day. Take Stilizan at around the same times every day. Follow the directions on your prescription label carefully, and ask your doctor or pharmacist to explain any part you do not understand. Take Stilizan exactly as directed. Do not take more or less of it, or take it more often than prescribed by your doctor. Your doctor will probably start you on a low dose of trifluoperazine and gradually increase your dose. Your doctor may decrease your dose once your symptoms are controlled. Stilizan may help control your symptoms, but it will not cure your condition. Continue to take Stilizan even if you feel well. Do not stop taking Stilizan without talking to your doctor. If you suddenly stop taking Stilizan, you may experience withdrawal symptoms such as nausea, vomiting, dizziness, and shakiness. Your doctor will probably want to decrease your dose gradually. When to take Stilizan? Before taking Stilizan, tell your doctor and pharmacist if you are allergic to trifluoperazine, other phenothiazines such as chlorpromazine, flufenazine, perfenazine, perchlorperazine, compazine, promethazine, phenergan, or thioridazine, or any other medications. Tell your doctor and pharmacist what prescription and non-prescription medications, vitamins, nutritional supplements, and herbal products you are taking or plan to take. Be sure to mention any of the following: anticoagulants, blood thinners, such as warfarin, Coumadin, antidepressants, antihistamines, atropine, inmodofen, inlomotil, inlunox, barbiturates such as pentobarbital, nembutal, phenobarbital, luminal, and secobarbital, seconal, diuretics, water pills, epinephrine, EpiPen, guanethidine, not available in the U.S., ipratropium, Atrovent, lithium, Escalith, Lithobid, medications for anxiety, irritable bowel disease, mental illness, motion sickness, Parkinson's disease, ulcers, or urinary problems, medications for seizures such as phenytoin, Dilantin, narcotic medications for pain, propranolol, Inderal, sedatives, sleeping pills, and tranquilizers. Your doctor may need to change the doses of your medications or monitor you carefully for side effects. Tell your doctor if you have or have ever had liver disease or any condition that affects your blood cells, including conditions that affect the production of blood cells by your bone marrow. Your doctor may tell you not to take Stilizan. Tell your doctor if you have or have ever had pheochromocytoma, tumor on a small gland near the kidneys, breast cancer, glaucoma, condition in which increased pressure in the eyes can lead to gradual loss of vision, trouble keeping your balance, seizures, chest pain, or heart disease. Also tell your doctor if you plan to work with organophosphorus insecticides, a type of chemical used to kill insects, or if you have ever had to stop taking a medication for mental illness due to severe side effects. Tell your doctor if you are pregnant, especially if you are in the last few months of your pregnancy, or if you plan to become pregnant or are breastfeeding. If you become pregnant while taking Stilizan, call your doctor. Stilizan may cause problems in newborns following delivery if it is taken during the last months of pregnancy. If you are having surgery, including dental surgery, tell the doctor or dentist that you are taking Stilizan. If you are having a myelogram, X-ray examination of the spine, tell your doctor and the radiographer that you are taking Stilizan. Your doctor will probably tell you not to take Stilizan for 2 days before the myelogram and for 1 day after the myelogram. You should know that this medication may make you drowsy and may affect your thinking and movements, especially at the beginning of your treatment. Do not drive a car or operate machinery until you know how this medication affects you. You should know that Stilizan may cause dizziness, lightheadedness, and fainting when you get up too quickly from a lying position. To avoid this problem, get out of bed slowly, resting your feet on the floor for a few minutes before standing up. Ask your doctor about the safe use of alcohol during your treatment with Stilizan. Alcohol can make the side effects of Stilizan worse. Plan to avoid unnecessary or prolonged exposure to sunlight and to wear protective clothing, sunglasses, and sunscreen. Trifluoperazine may make your skin sensitive to sunlight. You should know that Stilizan may make it harder for your body to cool down when it gets very hot. Tell your doctor if you plan to do vigorous exercise or be exposed to extreme heat. You should know that there is a small chance that people who handle Stilizan tablets will develop a skin rash. Anyone who helps you take your medication should avoid touching the tablets directly. What special dietary instructions should I follow? Unless your doctor tells you otherwise, continue your normal diet. What should I do if I forget a dose? Take the missed dose as soon as you remember it. However, if it is almost time for the next dose, skip the missed dose and continue your regular dosing schedule. Do not take a double dose to make up for a missed one. What side effects can Stilizan cause? Stilizan may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away. Dizziness, feeling unsteady, or having trouble keeping your balance. Blurred vision. Dry mouth. Stuffed nose. Nausea. Difficulty urinating. Widening or narrowing of the pupils, black circles in the middle of the eyes. Constipation. Changes in appetite. Weight gain. Blank facial expression. Shuffling walk. Agitation. Jitteriness. Unusual, slowed, or uncontrollable movements of any part of the body. Difficulty falling asleep or staying asleep. Headache. Extreme tiredness. Weakness. Breast enlargement. Breast milk production. Missed menstrual periods. Decreased sexual ability in men. Some side effects can be serious. If you experience any of the following symptoms, call your doctor immediately. Fever. Muscle stiffness. Falling. Confusion. Fast or irregular heartbeat. Sweating. Yellowing of the skin or eyes. Flu-like symptoms. Sore throat, chills, and other signs of infection. Neck cramps. Tongue that sticks out of the mouth. Tightness in the throat. Difficulty breathing or swallowing. Fine, worm-like tongue movements. Uncontrollable, rhythmic face, mouth, or jaw movements. Seizures. Blisters. Rash. Hives. Itching. Swelling of the eyes, face, mouth, lips, tongue, throat, arms, hands, feet, ankles, or lower legs. Erection that lasts for hours. Vision loss, especially in low light.